All right, well, we're going to go ahead and get started in case other people join us. My name is Captain Tracy Galandi. I'm a senior public health analyst with HRSA, and HRSA is Health Resources Services Administration. We're in the Department of Health and Human Services, and I work for the Bureau of Health Workforce. I'm at the Dallas Regional Office, and I am the state lead for the National Health Service Corps for Arkansas and the Northeast Texas region. And what we're going to talk about today is I'm going to give you an introduction to the Bureau of Health Workforce, which I kind of did a little bit. We're going to talk about National Health Service Corps loan repayment programs and scholarship programs. We're going to talk about how to become a National Health Service Corps site and the application process. And we're also going to talk about Nurse Corps, which may be interesting to some of our participants that are nurses out there, and then give you some resources. Now, the Bureau of Health Workforce, what we do is we improve the health of underserved populations by strengthening that health workforce. We connect our skilled professionals to communities in need through education programs, training programs, and then service commitment. We've been around for 50 years, so we are not new, and we build healthy communities by putting qualified professionals in health professional shortage areas. And our areas are primary health care, primary medical, primary dental, and primary behavioral health. And a couple of years ago, we added primary care SUD, substance use disorder programs. And then so what we do is we put these professionals in what's called health professional shortage areas, which I'm going to talk about later. And then we help these clinicians pay off their debts in exchange for service in these high need areas. Now, right now, we have more than 18,000 members that are providing services to 19 million people across the U.S. And the types of professionals that are in our program is 47% are behavioral health providers, 29% is nurse practitioners, 14% physicians. We have 10% PAs, 8% are dentists, 3% are pharmacists, 2% are registered dental hygienists. We do have a small percentage of registered nurses, and they're substance use disorder program nurses. And I'm going to talk about for our RNs, Nurse Corps. That's going to be the second half of my presentation. But we do have some RNs in our substance use disorder loan repayment program. We have a small percentage of certified nurse midwives and nurse anesthetists. Now, when we talk about health professional shortage areas, we abbreviate this as HPSAs. And what a HPSA is it basically tells us where the shortages are. Now, if you see at the top of the slide, you can find out what your HPSA score is based on your address at this website, or if you just type in HPSA Find in Google, it's usually the first thing that pops up. And so what you could do is you could search for your HPSA score by address or by county, and there's several different types of HPSAs. HPSAs range from 0 to 25 for primary care and mental health, and 0 to 26 for dental. And the higher your HPSA score is, the higher the need. And so we have geographic HPSAs, which basically means that you have a geographic shortage of providers. We have what's called facility HPSAs, which is our rural health clinics. There are certain facility type, and so they qualify for a facility HPSA. That would be your rural health clinics, your state mental health hospitals, our correctional facilities, our federally qualified healthcare centers. Those are facility types. And then you have a population group. So if you have an area that has a high concentration of homeless, that could be what's considered a population HPSA. That site or that area may have a homeless population HPSA score. So those are our HPSAs. Now, when you look at HPSA Find, I put this in here, the medically underserved areas, you're going to see medically underserved areas scores as well. That doesn't apply for the National Health Service Corps program. That applies for other grant programs that's not National Health Service Corps. I just wanted to put that out there just because you'll see both scores. And what you're looking for with National Health Service Corps is you're looking at HPSAs. So our loan repayment program, this is, you have to be a U.S. citizen and you have to currently work at an NHSC approved site. So the site applies for NHSC approval first. usually the year before the clinician applies. So they apply for NHSC approval. They go through an approval process. It could take 2 to 3 months. And then the following year, if they're approved, then all of the clinicians at that site that are these eligible clinicians can apply for the loan repayment. You must have unpaid government or commercial loans, and it must be for the tuition for the that led up to the program that you're in or that you're applying for. So things that don't qualify would be like our Parent Plus loans. Also, if you consolidated your loans with other debt that's not student loans, that wouldn't qualify. And you also must be licensed to practice in the state where your employer is located. The only exception to that is if you work for a federal government, like if you work for the Bureau of Prisons or Indian Health Reservations, you could just be licensed in any state. That doesn't matter. And then so the clinicians that apply for this program or that can apply would be our doctors, nurse practitioners, nurse midwives, our PAs, dentists, dental hygienists, psychiatrists, psychologists, LCSWs, our psychiatric nurses, marriage and family therapists, and LPCs. And then NHSC provides $50,000 for 2 years of service. And the way that they award this is they award the highest HPSA scores first. Say you are a physician and you're in a primary care HPSA of 26 or 25. I'm sorry, 25, 24. This year they awarded from 25 down into 16. So if you're in 16 score of 16 to 25, you're pretty competitive as of this year. Each year is different. It depends on the number of applicants and the funding. In the years past, the 2 years before this year, they awarded every single applicant because we had a boost of funding with the COVID-19 funds. So in 2021 and 2022, they awarded every eligible applicant, and they went all the way down to a HPSA score of 3. So that hasn't happened in several years. But you never know what's going to happen. So it is a competitive program, but it's always good to apply, especially if you're in a competitive HPSA. And then we have another program, which is our substance use disorder. We call it SUD. And so our SUD program provides up to $75,000 for a 3-year service commitment. And you must be trained and licensed to provide SUD treatment at a National Service Corps site, SUD treatment facility. Our rural community loan repayment program. Now this one is same as the last one. You have to be at a substance use SUD site, providing SUD care, but this program you must be in a rural area. And we actually give higher priority to the NHSC sites that are our core consortium members. So they get awarded first. So it's a very competitive program, but they do give higher priority to consortium members. And so you have to have a rural designation, and the rural designation must be designated as rural by HRSA and not CMS. So if you go to Am I Rural, that website is called Am I Rural, you can look up your designation. And it's the RCORE designation for rural, not the CMS designation. And then next, we have what's called our Students to Service Loan Repayment Program. I really like this program. This program this is for physicians and dentists, nurse practitioners, PAs, and let's see, APRNs. And they have to be primary care if they're in the physician category, unless they're OBGYN, peds, or geriatrics. Those are the only subspecialties that they allow physicians to practice in. And so they apply during their final year of med school or dental school or PA school, whichever school they're in. And we give them $120,000 for a 3-year commitment. Now they give it 1/3 for 3 straight years. And then or $120,000 for a 6 years halftime commitment. Now the only requirement is that not this the only requirement, it's the same as the other requirements as far as you have to be a U.S. citizen to apply, things like that. But when you get the award, you must work in a HPSA of 14 or higher for your discipline. And if you're a physician and you're applying your last year of med school, then the way they do it is you complete your service after your residency. So you get your 1/3 during the first year residency, your 1/3 second year residency, 1/3 third year residency, and after your 3 years of residency, then you can start your service time, or if you want to pursue a specialty in OBGYN, pediatrics, or family practice, then you can delay your service time to do a fellowship after residency. Our scholarship program, this program is a good program, and this is for people pursuing their degree in medicine or dentistry, or if you're pursuing a postgraduate degree in the AP as an APRN or a PA. And then you could be specializing in adult medicine, family medicine, geriatrics, pediatrics, psychiatric mental health, or women's health. So this is the scholarship program, and the scholarship program, oops, let me go back. The scholarship programs, basically, we pay for all of the tuition and fees of your program, and then you owe us back the number of years we supported you. If we supported you all 4 years of med school, then when you graduate, then you owe back 4 years of service. Now, there is a minimum 2-year service commitment. So if we only supported you for 1 year where we pay for all your tuition fees and a stipend, and the stipend is right now it's $1,500 and something per month. Then you owe back 2-year commitment. And each year they publish the minimum HPSA scores for scholars. So pay attention to that. Some scores are higher than others. This year, most of the HPSA scores are 19 for primary care medical. Except for PAs, there's a minimum HPSA score of 3. That means you have to work at a site that has that HPSA score. Now, with all of our NHSC programs and our scholarship programs and our S2S programs, we pay for your relocation. I don't have a slide on this, but we pay up to $10,000 expenses for you to relocate if you need to accept a job in another area away from where you graduated. We do provide funds for relocation. We also provide funds up to $1,200 to do site visits when you're interviewing at sites to kind of check sites out and things like that. Now, our state primary care office, this is your primary contact if you're interested in being a National Service Corps site. They provide technical assistance for our potential future sites, and they also do our shortage designation. They provide the data that we use to provide these HPSA scores, and so we update HPSA scores typically about every 3 years for POP and GEO HPSAs. So they're the ones that look at the number of providers in an area and provide that data so that we could score those sites. Now, to become an NHSC approved site, you have to be an approved site type, and you must provide comprehensive outpatient primary health care. And when we say primary health care, we mean primary health, primary medical, primary behavioral health, primary dental. The National Service Corps, you see it in the site reference guide frequently where we say primary health care. I'm a clinician, I'm a physical therapist, and to me, primary healthcare means primary medical, but the National Health Service Corps defines primary healthcare as primary medical, primary behavioral health, primary dental, and now we added primary SUD. Our only exceptions is we do allow CAUS, our critical access hospitals, and Indian Health Service hospitals as well into our program. School-based sites are also allowed in our program. We have a participant that's it's a school nurse. We do allow school-based sites in our program. And so they must serve in a HPSA. And then our participants must provide comprehensive primary medical, dental, behavioral health, and mental health. And they serve people in all areas, whether they're rural, urban, or tribal communities. Now, these are our eligible site types. We have what's called auto-approved. These sites do not need to well, they still need to apply, but they don't need to submit any documentation. So that would be our federally qualified healthcare centers or our lookalikes, also our Indian Health Reservation sites, and then our Bureau of Prisons and our federal ICE sites. Now, the ones that must apply and show that they meet our criteria would be our state correctional facilities, critical access hospitals, rural health clinics, our community mental health, our state or local health departments, our community outpatient facilities, private practices, school-based clinics or mobile clinics, free clinics, and sub-treatment facilities. Now, if you're interested in being a site or you're interested in applying for our Nurse Corps or National Service Corps program, you have to go to our Bureau of Health Workforce online portal and develop an account. And you can log in as an applicant, a participant, or a site point of contact. And then the required documents to be a National Service Corps site is you have to have policies on non-discrimination, and you have to cover all of the areas that's in our site reference guide. You have to have a sliding fee discount program. You have to have proof of access to ancillary inpatient and specialty care. You have to submit your site data, which basically you have to report how many patients you've seen in the last 6 months that were Medicare, Medicaid, sliding fee, private insurance, things like that. And then if you're a behavioral health site, you must provide a comprehensive behavioral health services checklist. This is part of your application in the portal, and provide that supporting documentation. If you're a substance use disorder site, you must provide SUD documentation, and you must have a clinician recruitment and retention plan. And that recruitment and retention plan must include strategies on increasing resiliency and decreasing burnout. Now, all of these things that I'm telling you is available on our website, where it has examples, multiple examples of all of these policy documents that are required. Now, our sliding fee discount program, it must be based solely on family size and income. Take a sip here. You must base it on current federal poverty guidelines, and it must apply to up to 200% of our federal poverty level. And you must have it in place for 6 months before you apply. And like I said, our website has a lot of information for you on how to apply to be an NHSC site. Now, the sliding fee scale discount program must have a schedule of fee for services, and then and it must have a chart that shows us the discounts that you provide for each level, and it must slide based on income. You must have policies and operating procedures that talk about how you implement your sliding fee scale. It can't consider any type of assets or credit card balances or credit checks when determining eligibility. You can't request proof of citizenship, and you can't require Medicaid denial letters as a requirement for sliding fee discount program. Now, you can assist patients on applying for Medicaid. You can encourage them to apply for Medicaid, but you can't require it. Now, this year, we're going to open up we open up once a year for any new sites. And this year it's tentatively scheduled to open in April of 2024 for any of our new sites that are interested in coming in. And you can be private practice. Well, I get that question a lot. Do you have to be nonprofit? No, you could be a private practice site and apply for you can even be a solo private practice. So you'd want to reach out to your state primary care office for support. You want to review that National Service Corps site reference guide. That's what we call our Bible. It's very comprehensive, and there's lots of appendices that have examples of our documents. You can even copy and paste our examples of our documents as long as you make them your own policy. I think they're named ABC Healthcare in our examples, but you would have to make that your own policy. But you can definitely copy and paste that wording that's in our examples. We don't mind that. And then you have to ensure your policies are established prior to application. We want you to put your policies in place. Now is a good time if you're interested in coming in to start looking at these policies, developing these policies, and then putting these policies in place, because you have up to 6 months to get these policies, or these policies should be in place before you apply. And like I said, it opens in April, but it closes in usually June of the same year. And next, I'm going to talk a little bit about Nurse Corps. Now, Nurse Corps is a little bit more of a flexible program. Nurse Corps sites do not need to apply to be a Nurse Corps site. They just must be in a health professional shortage area. And Nurse Corps offers both loan repayment programs, and they also offer scholarship programs. Our loan repayment program is for nurses who work in facilities that are in what we call HPSAs. And that HPSA can be either a mental health HPSA or a primary care HPSA. So with Nurse Corps, they use whichever HPSA score is the highest between the mental health and primary care, because if you're a nurse, you know that you don't just do primary care. Nurses, no matter what they do, have some aspect of mental health in their job. And so we allow them to use the mental health HPSA score or the primary care score. And so what we do is we do loan repayment. We also have loan repayment for nurse faculty. And then we have scholarships for nurses, for students that are enrolled in nursing degree programs. And that could be an RN program. It could be a nurse practitioner program. It could be a doctorate of nurse practitioner. So those are the eligible programs for our degree programs. Also, I'm going to say it doesn't have to be a bachelor's RN program. It could be it just has to be an RN program. So it could be an associate's RN. So the nurse program, what they do is they help alleviate these critical shortage of nurses. And currently we have more than 3,300 Nurse Corps participants serving at over 2,500 sites. I can tell you that our scholarship program is pretty competitive. It's a little more competitive than our National Health Service Corps loan repayment program. And so our nurse participants provide care to 3.5 million patients annually. And so these are our type of critical shortage facilities that qualify. Remember how I said National Health Service Corps, you have to be at an outpatient clinic? Well, Nurse Corps, you just have to be in a community-based setting, or you could be in a hospital. So it could be a private hospital, you could be a public hospital, it could be a school-based site. You can also work in ambulatory surgery, all of these home health agencies, hospice. So Nurse Corps, like I said, is a lot more flexible. The sites don't need to apply. They can be any of these site types as long as they're in a HPSA. Now, the site types that aren't eligible for Nurse Corps, that would be your correctional site. For some reason, they don't authorize correctional facilities for Nurse Corps. The loan, you could do the scholarship program to help you get through school, or after, if you're already a nurse, what you could do is our loan repayment program. This is actually a really good program. And so they offer loan repayment to nurses who are working in these critical shortage facilities that are in a HPSAs. We also, like I said, have faculty programs. And the way the nurse program works is that you have to be a licensed registered nurse or an APRN or a nurse faculty member, and you must have received your nursing from an accredited school, and you must work full time at a critical shortage facility. And so what they do is you have a 2-year minimum with an optional 1 year. And remember how I said with National Service Corps, it's competitive based on HPSA score. They award the highest first. Well, with Nurse Corps, the way that works is they award it based on debt to income ratio. So they look at debt to income ratio. And then also both programs, National Service Corps and Nurse Corps, give priority to students or clinicians that claim disadvantaged background status. So we have a definition of disadvantaged background status on our website, but you would fill out a form if you're claiming disadvantaged background, and you get a higher priority than someone that doesn't have a disadvantaged background. And so the way it works is we award 60% of your student loans for a 2-year commitment, and then an additional 25% for a 3rd year if you decide to continue. So you can get 85% of your student loans paid for just for working 3 years. And you would probably be working at this facility site anyway. So it's a good program. And like I said, some of our APRNs have several $100,000 in debt. So they get a lot of bang for your buck with this program. And half of our LRP awards are set aside for nurse practitioners. I'm sorry. And then up to 20% of the budget is awarded for nurse practitioners that are providing services in a psychiatric mental health facility or behavioral health care capacity. And so our Nurse Corps Scholarship Program, we offer Nurse Corps scholarships to clinicians, like I said earlier, that are pursuing their nursing degrees. And then once they graduate, they must serve in a site that has a HPSA score of 14 or higher. So I'm just going to put that out there. If you live and work in Little Rock and you want to stay in Little Rock's HPSA score is only 12. So keep that in mind if you're if you're a nurse in Little Rock. I just want to put that out there because we have some nurses that have applied as a scholar and then now they're trying to find a job, but they have to have a score of 14 or higher. So you would have to work, if you're in Little Rock, you would have to work a little further south in Pine Bluff, places like that to meet this requirement. And so the maximum number that we would support you is 4 years. And so, like I said, you must exchange service time based on years of support. And what we cover is all of your tuition, fees. We give you an annual payment for other costs such as books and things like that, and a monthly stipend. Now that monthly stipend is pretty important because it's around, I think this year is around $1,500 a month that we provide. So that's a good scholarship, is a good program. And it offers funding preference for applicants with the greatest financial need. So how the scholarship program works is you would be asked to write several several essays on how and there's usually an essay question, and so you would you would submit your essays. You have to submit letters of recommendation from a faculty and a coworker, and then they look at your CV or your resume to see your work experience, to see have you worked in underserved areas, things like that. So that's what they look at for scholarship program. And so this year we awarded $62 million and provided 512 new awards for Nurse Corps loan repayment. Sorry. And then our scholarship program awarded 35 million and 293 awards. Now, like I said, I work in the Dallas regional office, but these are our 11 regions or 10 regions, sorry. And so I'm the contact for Arkansas. And this is Latarsha Thomas is at the state primary care office. So she is our contact for the state PCO. We call it PCO, primary care office. And this is her contact information. Michael Trevino, he's the supervisor for the primary care office, but he also works for the Office of Rural Health and Primary Care. So if you're interested in becoming an NHSC site, these are your primary contacts to reach out first for application help. And then also, if you have a question about your HPSA score, you can reach out to Michael Trevino because he's the one that works with the primary care office to provide that data to score the HPSAs. And then these are just some resources. I think Jenny can put out this slideshow. The slideshow has been cleared for public distribution. So Jenny, if you wanted to put out the slideshow with the slides where they can click on these links, these are all of our resources for our resource slide. Before I answer questions, our Division of External Affairs has asked us to plug our HRSA grant reviewer. We're always looking for grant reviewers, and I've done this a few years, and it's very enjoyable. But what you do is you read these essays for our scholarship programs, and you score them. And there's other areas where you can apply to be a grant reviewer, whether it be behavioral health, health workforce, maternal child. They're always looking for grant reviewers. And what it is it's basically you're a volunteer and you read these applications and score them and things like that. So at this time, I would like to open it up for any questions. I know we don't have a lot of participants that are live, but this program is being recorded for distribution. So I'm going to go back here to my contact us slide. So if you're listening to this as a recording and you have further questions, then these would be the contact emails that you can reach out to us. And at this time, if you want to type your question in the chat, if you have a question, and I'll just give it a couple minutes. And if there's no questions, we can close early. That's not an issue.
Tracy, I have a question.
Yeah.
I noticed that, it said, dentists, DOs, and, but there were specialties like, pediatrics, geriatrics. Anyway,
Yeah,
is
yeah.
psychiatry a
Uh-huh.
specialty that, is open to this program?
Yeah,
Because we,
so if you read our site reference guide, it says that you can't be a specialist. And what they're talking about is that you can't be a specialist in like orthopedics or nephrology or things like that. But the only allowed specialties is pediatrics, OBGYN, psychiatric, and geriatrics. Yeah, those are the
well,
four
excellent.
allowed specialties. Yeah. Otherwise, you
I'm
have to be primary care or family
excellent.
practice. That's a great question, though.
Thank
And
you. We
same
heard
with dentist. Yeah. Same with dentist. Dentists can be specialists in pediatrics as well, or well, they can't be psychiatric dentists. But, but they can, yeah,
that. Wonderful. Thank you for
you're
that.
welcome.
Well, I don't see any questions in the chat at the moment.
Okay, no problem. Well, if anyone has questions, if you're listening to this recording, like I said, there is a typo I see in the slide. On Michael Trevino. It's michael.trevino at arkansas.gov. I left out an O. I apologize about that. Or Latarsha.thomas at arkansas.gov is how to get to the primary care office.
Awesome.
Well, thank you, Jenny, for inviting me. And thank you so much. And if anybody has any questions, please feel free to reach out to me.